everyone, this is Dr. Elsa Orlandini with the Miami Psychology Group in South Beach, Florida. I am conducting a series of talks in order to help people cope with the corona quarantine and crisis. I requested some questions yesterday and some people were able to ask some questions that I think are very important. What we're noticing is a saturation in everyone being bogged down with information related to what's happening with this pandemic and how many people are being affected, what people are doing to prepare for it, what people are doing in order to cope with it. And what I see happening in general, not just in my clinical practice, but also in my personal life, is that people are getting saturated with information. Whether it be through watching too much news or Facebook or communicating with people in which the content that's being discussed is content that's overwhelming, it's negative, it's catastrophic, and it creates a sense of panic that will actually affect you in a sense that you'll develop what's called a fight or flight response, which is that your body is developing tension, it's accumulating, it's exhausting, and if you have enough of that, it will actually affect your immune system. And since it can affect your immune system, it's actually counterproductive to what we need to be doing right now. So the topic for today is boundaries. What are we going to do to create healthy boundaries so that we stay informed? At the same time, we make sure that we orient the people around us, what we're willing to talk about and not talk about. It's important to inform people that, I don't really want to talk about what could happen in a catastrophic way. Focus on what are things that you are doing to prepare, and limit the content of the conversation to be prepared focused and also focused on positive things, reminiscent things, things that stimulate you in a positive way, things that are comical and humorous, not because of what happening is not serious, but rather you have to look at what is the amount of information a brain can tolerate that will negatively affect your ability to cope, and it is your responsibility to filter what content comes in. So the boundaries are: what news are you watching? How much news are you watching? What are you reading? What people are you interacting with? What are you discussing? And can you focus on these discussions being positive, constructive, and based on what you actually do control? At this point, what do we control? We control making sure we have what we need, and obviously not in a way that's hoarding and that we're taking away from others that may need. And we control whether or not we expose ourselves and our cared ones. So being quarantined is very important, and making sure we limit going out. If there's a way to be a positive influence on others, we can do that. For example, this video is one of those ways that I can dedicate some time in helping other people and hopefully answering some questions based on what I'm seeing in practice. The other thing is recognizing that if we don't stop these penetrations and these boundaries, what we're doing is we're inviting toxicity. So that toxic content plus the stress plus being in a place where you have limited stimulation, you're choosing to make your brain feel negatively. You're choosing to feel more stressed out. You're choosing to possibly invite your immune system to get weaker, and hopefully we can stop that from happening. So that's today's topic, boundaries. Hopefully that will help you and that you're able to choose ways to apply this in your lives, and we'll have another topic later. Feel free to add topics if you like, direct message me if you like, or even on the bottom of this post, put what you would like for me to discuss. I have many topics, so I look forward to seeing you and hope you're all staying strong. Hope you're all staying positive and understand that we're all here to help each other and rely on each other as much as you can. Take care. Bye.